We've done quite a lot of work over the last number of years developing new treatments for urinary tract and bladder cancers. The AURORA trial is specifically for a rare type of bladder and urinary tract cancer called squamous cell carcinoma. And these patients have had limited opportunity to take part in clinical trials previously. There's only been one previous trial dedicated to this group of patients, and we wanted to test whether or not they might benefit from conventional immunotherapy drugs, which we're using routinely in the clinic for other cancers. So we put together this clinical trial proposal, and we're delighted it's been funded by Cancer Research UK recently. And in the trial, we will take these patients with a rare type of cancer, and we'll treat them with immunotherapy with a drug called atezolizumab, and then we'll look to measure the response to treatment and how their clinical course develops. Rare cancers are challenging, and that's well recognised. I treat bladder cancer, but what that really means is that I have lots of evidence for the common type of bladder cancer. I have very little data available for those with the rare types of the disease. And that's because the trials are difficult to run. Finding these patients and doing it in a way that allows you to generate enough information to actually hopefully change practice is challenging. But it's not impossible. Our trials unit is involved with a group called the International Rare Cancers Initiative, within a subgroup specifically looking at rare types of bladder cancer, and we hope therefore that allows us to create enough interest and critical mass to take forward a study of this sort. What's novel about this study is trying to test an established and standard treatment in a group of patients that otherwise wouldn't have access to it. We'll determine and find out whether it's a beneficial treatment, and we have some pilot data that leads us to believe that might be the case. This study will be the step towards actually working that out for certain within the clinic.